Folks, let's move along here to our monthly visit with U of R Noise Health. Dr. Jean Archer-Colella, who is, as I admitted earlier, is a podiatrist. She is the Noise Hospital resident podiatrist, certified wound specialist. And Dr. Archer-Colella, thanks so much for joining us.
Thank you for having me.
So, the podiatrist, as a podiatrist, what specifically do you do with your patients down there at Noise?
Well, primarily, as a podiatrist and wound care specialist, the majority of the care that I provide is treating diabetic foot ulcers. And what we've noticed with wound care, what makes for successful healing of these wounds, and obviously the goal is to prevent lower extremity amputations, we found that, the best approach is a team approach.
Okay.
And yes.
Yeah, go ahead. It's a team approach. So a patient comes in and they present with the usual, the diabetic-related foot issues.
Foot ulcers.
Yeah, ulcers, right.
Yeah.
Right. But, yeah, so the diabetic foot ulcer is actually a common foot wound that we see. Primarily what it is basically an open sore or wound, and it's generally occurring in patients with diabetes and commonly located on the bottom of the foot. And one of the things that we've noticed with the affiliation of Noise and the U of R is that now we have greater access to specialists and the care that would make this team approach possible. And actually help in the healing of these wounds. So the mantra is to save a limb is to save a life, because we know that mortality rates and death rates increase with lower extremity amputations.
Yeah, so typically what happens is, they lose a toe, then they lose the foot, then you start to lose, the rest of the limb. And then that, of course, diabetics tend to have circulatory problems anyway. It exacerbates the rest, and everything else kind of proceeds like that, right?
Right. So the patients that we see that are high risk for diabetic foot ulcers is generally patients that, one, have diabetes, also have neuropathy, which is nerve damage or loss of feeling in the foot, poor circulation, so these wounds don't heal well and then progress. They can progress if they don't heal well to becoming infected, and then that starts sort of like that cascade of events, that if you don't intervene early enough can result in the lower extremity amputation.
Okay.
So the goal of wound care is actually prevention.
Sure. Dr. Ralph Viola from iZone Rochester.
Boy, I had a different question. We want to stay in the diabetic idea for a second here. So, in my training, we've always learned that when you get diabetic neuropathy, that leads to the ulcers because, in a person without neuropathy, when they walk, that they, without even thinking about it, they change what part of their foot hits the ground every time they take a new step, so that the force of the walking is evenly distributed across the whole bottom of the foot. And when you have neuropathy, you lose that feedback mechanism. So then every time you walk, the same part of your foot slams against the ground every time. And then you get breakdown of the skin. That's how you get your ulcers. Is that still the thinking?
That is correct. And what actually amplifies that is if the patient has certain foot deformities like bunions or hammer toes, and again, you get increased pressure loads on certain areas of the foot. They don't feel it, and then that can result in breakdown of the skin and then ultimately, a foot ulcer.
Okay. Paul Sussman from the Center for Cosmetic Dentistry.
Hi. When you said you benefit from a team approach, what are the other team members? Are there different specialties involved, or?
Right. So that is a good question. So the team approach is, for successful wound care, we generally require all disciplines of medicine. So we have physicians, such as vascular doctors, who we consult to see if we can improve the blood supply to the wound. Blood supply is key in healing, because if you don't have that, you really, are almost fighting a losing battle. We do get consults from infectious disease who aid us in, the antibiotic selection, especially if we have an infected foot ulcer. We generally use wound cultures, biopsies. Those are sampling of the tissues and bones so that we know exactly, what infection is there, and sometimes we may need infectious disease. So vascular surgery and infectious disease, and also, just addressing some of the underlying, health problems that could be contributing to why this person has, uncontrolled diabetes. Again, diabetes that's uncontrolled actually is a big obstacle to healing.
How are we doing with preventive medicine as regards diabetes, Dr. Archer-Colella?
Right. So the key in my area of specialty, one of the main things, and when a patient comes into me, the first question that I ask them is, what's your hemoglobin A1c, or what was your last hemoglobin A1c? Because we find that, and the research shows that if you have increased hemoglobin A1cs or hemoglobin A1cs so a hemoglobin A1c, and I'll just kind of explain what that is basically the control of your diabetes over a 3-month period of time. And this can be done through a lab test. So your medical doctor can, if they suspect that you have diabetes and are being treated, they monitor you with the hemoglobin A1c. So it's very critical, for prevention to control the diabetes, and monitoring the hemoglobin A1c and keeping it in ranges of, let's say, 6, 7 are key to wound healing. Anything above that, it's an obstacle to wound healing. So that's like the main thing that's the main question I ask my patients or try to find out in terms of preventing the diabetic foot ulcers.
One of the things we're hearing in the national media, by the way, speaking with Dr. Jean Archer-Colella, a podiatrist, and she is actually the resident podiatrist at Noyes Hospital in Dansville and Geneseo. We're hearing narratives of increasing costs of insulin. Is this being addressed?
So we do have specialists within Noyes who are trying to address that problem, but you're right. Sometimes with with healthcare costs, that becomes an obstacle too. So I believe there are efforts being made to address that as well.
Okay, great. If somebody has questions and they need additional information, and you can help out, maybe a friend or a family member or a coworker is somebody who is suffering from diabetes, and do you think that they could be in need of the team approach at Noyes to wound care? Give them some contact information, if you would, Doctor.
Sure. They can actually contact their primary care doctor, who can initiate a referral to our hospital. I'm practicing at Noyes Hospital, and the contact information basically would be just to call either the main hospital, or I can give you the phone number.
That'd be great. Sure, please.
It's 585-335-9360. And they can, contact that number and schedule an appointment for consultation.
Dr. Ralph Ayala has one final question. Go ahead, Ralph.
Yeah, this is not a diabetic question, and it's either going to get me in trouble asking or it's going to be a wow moment here. When I was an intern back in the 80s in Philly, I rotated through the foot and ankle part of the hospital, and we used to see a lot of ladies come in with bunions and hammer toes, and we were told this from years of wearing high heels and poor posture, and the doctors would spend a lot of time trying to talk these people out of wearing such a high heel. Is that something that you see a lot of over here? Is that something that people need to be aware of? To maybe get a flatter heel or something or whatever? Are we seeing these kinds of damages here?
Well, that's a good point. I mean, the thing is that as women more than men generally tend to have bunion deformities and hammer toes because of tight shoe gear. However, there is, genetic component to that. Some people, it's in the family. They inherit the foot type of their mom and dad, but definitely wearing tight shoes can set one up for a bunion or a hammer toe deformity. And the thing about that is it just gets worse and then ultimately may require surgery to correct. And I treat a lot of that in my practice as well.
Dr. Jean Archer-Colella, a podiatrist with Noyes Hospital, thanks so much for being with us here on Health Talk. We appreciate the information.
Thank you. It was a pleasure.
All right. Take care.